How to enroll in Prime for independent users. You will need the BC Services Card app set up on your mobile phone or tablet. Prime only collects your name, address, and birth date from the BC Services Card app. Prime does not access your health information or personal health number. You will need your college name, license type, and relevant college ID numbers, and the email address of the person or team who sets up local PharmaNet accounts at your workplace. You can now enroll. Go to pharmanet.enrollment.gov.bc.ca. Click Begin Enrollment if this is your first time using Prime. Click Renew or Update Information when you renew your Prime enrollment once a year, or if you need to update your information. Click either if you are logging in to send your Prime approval email. Click Next to acknowledge the collection of personal information notice. This is where you log in with your BC Services Card app. The app will give you a pairing code to enter. Open the app on your device. Select Log in from a computer. Follow the instructions to enter the pairing code from the computer to log in. You are now logged in and can enroll. On the enrollee information screen, you will see that Prime has gathered your name, date of birth, and address from the BC Services Card app. Make sure your name matches the one on your BC Services Card. If it doesn't, or if there is a different name that your college uses for you, enter it in the preferred name field. You may also enter a preferred physical address or mailing address. Enter an email address that you can control and check regularly, where Prime can send notifications, and a phone number that may be used to contact you. In this video, a pharmacist who works in the community pharmacy enrolls in Prime. Click Save and Continue at the bottom of each page to move on to the next screen. If you need to go back to change something, use the Back button at the bottom of the page. Identify all care settings where you will be using PharmaNet. Select from the drop-down menu. If you work at more than one care setting, select Add Additional Care Setting and then add the details. In the next screen, under College Licenses, select your college. Enter your license class, registration number, and next renewal date. If your registration number is less than 5 digits, add leading zeros to make 5 digits. The number must have exactly 5 digits to work in Prime. Next, under Self-Declaration, you will be asked to answer 4 questions about your history of handling confidential information. If you answer yes to any of these questions, you will be asked to provide details, and your application will be sent for manual review. The Ministry of Health may be in touch for more information. You will then be able to review your Prime profile to make sure it is accurate. You can make any changes by clicking the pencil icon to the right of each section heading. Once changes are made, click Save and Continue. Check the box to certify that the information is true and complete. Submit your enrollment. If your enrollment was sent for manual review, keep an eye on your email for further instructions from the Prime team. Make sure to check your email spam and junk folder. The next steps are critical to completing your enrollment. When you see an approval notice on the Prime screen, click the Continue button. You must now accept the PharmaNet user terms of access. Check the box to confirm you have read them. Then click Accept Terms of Access. A pop-up window will ask you to confirm your acceptance. Enter the email of your PharmaNet administrator. This is the person or perhaps an area such as IT who sets up local PharmaNet accounts at your workplace or who coordinates with a PharmaNet software vendor. If you work at multiple sites, enter the emails for each PharmaNet administrator separated by a comma in the email field. Click Send. This provides the recipient of the email with both the approval notice and a link to the Global PharmaNet ID, GPID, assigned to you by Prime. Your enrollment in Prime is complete. The GPID must be included in your local PharmaNet user profiles, so it will be attached to all your transactions in PharmaNet. You can copy your GPID, but you are not required to record it. Your GPID is a confidential identifier. Please treat it accordingly. You will need to renew your Prime profile once a year, which involves updating your profile, if needed, reviewing and accepting the PharmaNet user terms of access. You will receive emails reminding you of your renewal date, starting 30 days before the date. You must renew to retain your PharmaNet access. If your situation has changed, such as working in an additional care setting or if you have changed work locations, before your renewal date you must return to Prime to update your information within 7 days. If you will not be using PharmaNet for more than 90 days, you must return to Prime to update your account or register your absence. Make sure also to ask your PharmaNet administrator to turn off your local PharmaNet account to prevent others from using it. If you have any questions about Prime, please call us at 1-844-397-7463 or email us at primesupport@gov.bc.ca.